working group will come to order. A quorum is present. The first item on the agenda are the minutes from Tuesday. Representative Frazier, are you able to move those minutes?
So moved, Mr. Chair.
Representative Frazier, any discussion to that motion? Seeing none, all those in favor, please say aye.
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 Opposed, say
Aye.
the motion prevails and the meeting minutes are approved. I just want to say by way of introduction that I find myself not in Minnesota to chair this hearing, a long-standing trip to look at colleges with my children, and ending up with technical difficulties in trying to chair this meeting by phone from a vehicle. So we'll see how well I prevail in that. And if needs be, I may have to turn it over to Senator Housley if for some reason this is not working. But we have three agenda items today primarily. The first is a delayed discussion of criteria to be used for distribution of funds. We will hear then from Commissioner Robinson, and then we will move on to, Robertson. Then we will move on to public testimony. So I had previously asked members of the working group to put together a list of criteria written down or otherwise submitted that we could use based on our discussions to date to go through and begin to evaluate how best to distribute $250 million. And I think given that everybody was asked to participate in putting this together, I think what I'll do is just go through the working group members one by one, call on you and ask you to lay out the criteria as you have described them. I know that my legislative assistant, New Vang, will be keeping careful notes of these. I also know that the LCC staff will be keeping minutes. So I think it will be helpful if members would describe their criteria, talk a little bit about it. We can have discussion at the end and see what kind of common agreement we have based on the discussion, and maybe get a report back next week based on that information that we collected. So in order of precedent, starting with the Senate, I guess I'll ask if Senator Housley is ready to talk about criteria as she sees them.
Thank you, Representative Winkler. And yeah, there were so many Minnesotans that stepped up during the pandemic and sacrificed a lot, not just them, but their families. And hearing all of the stories, wonderful, wonderful people. But I think it's clear that there was a group of people that had to go had much more risk of COVID in front of them every single day. Their work was different in the whole big group of essential workers. So those I feel, not that anybody should go in one bucket or another bucket, but I feel like our nurses and our long-term caregivers every single day having to double mask up is a little bit different than the other group of essential workers. And again, absolutely every single one of them were essential and did amazing things. But I think when we're going through this process, I think we really do have to think of those nurses and long-term caregivers that had to face COVID every hour of every single day. They were at much more risk. And in terms of criteria, I think even Commissioner Doty had laid it out earlier. I think it was Commissioner Doty. Taking into account were any of these essential workers collecting unemployment, or did any of these essential workers have the opportunity, did they have the opportunity to work from home or telecommute? Because there isn't a COVID risk when you're actually working from home. So I think those are the big factors that I think we should figure or we should talk about going forward. That's my criteria.
Okay, Senator Housley, thank you. I wonder, Senator Kiffmeyer, if you're prepared to describe yours.
Thank you, Mr. Chair. I would say that when it comes to criteria, I think the federal rules and all that were really frontline. So if you were able to work remotely, then I think that is something that would be a criteria that we should not consider those who have worked remotely. Not that they haven't done a lot of good things, but they aren't in that risk level, such as the long-term care, ICU nurses and things like that. I think the other criteria was sustained rather than incidental. And so I think there are those who are just on a very long time basis. We're in that. I think that is kind of the intention here. So I think those are some criteria that I would like to look at. I think the other part of it, as far as we kind of listened and we went through these things, I think those long-term care where they had a lot of cases, a lot of sustained effect, a lot of risk. Same thing with the nurse category. I would also say the first responders were also ones that had very frequent, very often, very much were involved with that. I think the big thing is the impact. I think there were others that had a significant impact, but I would say that group of first responders, the hospital nurse group, and the long-term care nursing homes, that sort of area, I think just really stand out to me in a pretty big way. And I think there are so many that this makes it very difficult, and how grateful we are for every single Minnesotan who stepped up in so many ways. But I think in accordance with the federal rules, I think what I've mentioned, I think fulfill that criteria and requirements the most strongly. So that's my comments for now, Mr. Chair.
Thank you, Senator Kiffmeyer. Next, Senator Murphy.
Thank you, Mr. Chair. Here we are to this, probably the first of our hard questions. I want to say that I had a conversation yesterday with someone who hasn't been part of the testimony that we heard. But for me, I think shines light on the complication of the question of risk and who bore the risk, especially at the early days of the pandemic when we didn't really understand everything that we needed to understand, or the things that we now know about how COVID was spread, the transmission rate, who was vulnerable, et cetera. So yesterday I spoke with someone who was a frontline worker in the courts before the courts went remote. So there were about 2 months when the courts continued to do the work because, of course, our pursuit of justice did not quit because of pandemic. And so it was the first time that I'd heard from that part of our society, if you will, from a frontline worker who I hadn't yet thought about. And much of the testimony that we've heard for me has I think driven me to 3 criteria that I'd share. The first, which both Senator Housley and Senator Kiffmeyer have mentioned, which is a frontline worker, meaning someone who was not working from home, and someone who was expected to go to work when many people were sent home. So for me, essential and frontline does mean present and facing that risk, especially when it was unclear. The second is about the risk that people bore. And, I've heard countless stories, of course, from nurses, nursing home workers, registered nurses, LPNs, CNAs, physicians, et cetera, who work across that continuum of care. And their stories are really, really important to me. But as important was the story that we heard from the person who was a transit worker who greeted somebody she knew who was stepping on the bus, and the woman said, "Pray for me because I have COVID." And the bus driver or the transit driver was a person in a multi-generational family living situation. That's risk. And so when I think about the risk, especially in the early days, there were many on the front lines who experienced different degrees, but real risk. And it's hard for me at this point to draw a circle around those who are in and those who are not. So I am reverting to one of the models of ethics that I learned as a grad student at St. Kate's and in my ethics studies as a registered nurse, and taking a more universalist approach, that we should do the most good for the most people. And while I know that I am suggesting that we consider all the frontline workers in this pool, I think there's a very good reason when we think about who was asked to do what and the risk that they faced for themselves and for their families. And so that is why I think we should think as broadly as we can about the pool of people and include them all, because they all did something really important for all of us that were able to stay home and stay home safely. So my 3 criteria, Mr. Chair, really on the front lines, they carried risk, and that we should do the most good for the most people. We should have a broad pool and include everyone. Thank you, Mr. Chair.
Thank you, Senator Murphy. Next, we'll go to Representative Frazier.
Thank you, Mr. Chair. Can you hear me well?
I can hear you well. I'm the one with the trouble, I think.
Thank you. I appreciate what all of my colleagues have just shared, and I agree. This is probably the toughest part of the conversation that we all knew it was coming, and now we're having it. And it is very hard. I agree with Senator Murphy. It is very hard to draw a line or circle and decide which workers, our essential workers, are on the front line, who's going to be in and who's going to be out. I think we all can attest to and agree with the testimony that we've heard so far from many of the testifiers have touched us all. It's informed us, again, around what we've already known, that there were so many of our essential workers that would put themselves in harm's way day in and day out, especially during the time where they had no idea what this virus was capable of, or how it was transmitted, or how dangerous it was, to be quite honest, and how dangerous it was for these individuals to come into work day in and day out, interact with individuals that were not known to them, and then have the risk of taking this back to their family members. So I think it's incredibly hard to draw a line to say one particular profession was at much more risk than the other. It's particularly specifically knowing that those first few weeks and months that all the essential workers were going in and day out and interacting with the public in a way that put them at risk or put them in harm's way. So I would agree also with the criteria to be as broad as possible. I lean back into House File 41, and I may be biased because I carried that bill, but I also know that it was vetted very thoroughly through the committee process throughout the session. We answered questions, many of these questions that we're struggling with now. We answered those questions. We modified the list of folks that were included based on some of those questions. So folks that were working from home, that's very easy. We could remove those individuals that were not in harm's way. But the list is very broad, and it's very much inclusive. It makes me think back to when the Louisiana presentation was done on Tuesday. They spoke of how their list was a lot more narrow and more limited when it first came through legislative process, and then it broadened and expanded as it went through the process. I think what we can learn from that is we can be broad right away, and then we can start to figure out how do we make sure that we cover as many people as possible. They also shared that they wish they had more resources to give out. And I ultimately think that's where we're going to end up here. I think we need to do as much good as possible, but I think we're going to learn that in order to do that, we're going to need to come back and take another look at this and probably likely have more resources for folks. And then I think we just make sure we have to remember that we are still in the middle of this pandemic, and our workers are still doing exactly what we're asking them to do and what's required of them to keep us moving forward and to keep all Minnesotans going, particularly for those that have the benefit and the privilege of being able to work remotely. So I want to be broad, help as many people as possible. We can look at the limitations based on the remote work and who was in harm's way. That's my overall criteria, Mr. Chair.
Thank you, Representative Frazier. Representative New Brindley.
Thank you, Mr. Chair and members, and thank you for all of the comments that have been made so far. I think actually it's kind of heartening to know that we all are at least somewhat on the same page, and I think that's helpful. Certainly some of the things that have been talked about so far, I agree with. Obviously, If someone could have been working from home, they probably should be excluded from this. If certainly if they've received unemployment, the folks from Louisiana were really helpful. If they've received unemployment during the time period that we establish, they should probably not be eligible. I do think that there is wisdom in the Louisiana model in that they did have a very defined period of time and numbers of hours worked. I guess I didn't put pen to paper on exactly what we might want that to look like, but I think that that's likely important criteria for us to factor in at some point. Beyond that, I would make just a broader statement that I agree. We have heard from so many people who have been affected by conditions over the last year and a half now. And so many stories from people and the work situations that they've dealt with. For me, I do think that there is a difference with those folks, our long-term care workers, our hospital nurses, our PCAs, first responders who were constantly potentially in harm's way in very real ways and probably different ways than most other workers. And so I do think that there is a difference in what those folks did, and that we should probably acknowledge and recognize that as we move forward and with whatever we choose to do. Thank you, Mr. Chair.
Thank you, Representative New Brindley. I'll go next to Commissioner Robertson.
Good afternoon, everyone. I'm speaking on behalf of all of the commissioners as appointed by the governor. The information that has been shared has been, I think, demonstrates that this is a difficult task, and we've all heard much of the same thing, and therefore our recommendations aren't substantially different than those that have been discussed already. But on behalf of the administration, we are, the criteria that we would like to put forth is the employees must have performed work in one of the named occupations or industries included in House File 41. As Representative Fraser indicated, this House File 41 was clearly vetted. There's been lots of discussion around it, and it has demonstrated that all of these workers made a significant contribution. And if they weren't on the specific front line in terms of caring for COVID patients, many of them were making certain that those that were caring for COVID patients, they made it possible for the nurses and the healthcare staff to be able to report to work. So, or helped facilitate the ongoing economics of the state or the food supply chain. So we simply recognize that many of us, there were many folks on different front lines that it took a collective approach in order to keep our economy going. So we would take a broader perspective and look to House File 41 to determine the specific occupations and industries that should be covered. Next, of course, the individuals that worked in person and could not telework. And we make that distinction because certainly some folks chose to continue to work in person. Certainly there were categories where the work simply could not be performed through telework. And so we believe that that is a distinction that should be covered. We also favor a defined work period, and just looking at from the time that the pandemic was declared up to June 30th of this year. And we find different scenarios in looking at that time period. Certainly we heard from Louisiana, but they had their approach was very early on. We've learned some different things after nearly 18 months into the pandemic, and we think that this is the appropriate time for consideration. We also support employees who perform work that heighten their exposure to COVID or worked in an environment that heightened the risk of exposure. So either performing the work directly or working in an environment that heightened the risk of COVID. And again, that would include those individuals who work to ensure other frontline workers were able to perform their work. Next, other or additional criteria that may be considered is the number of minimum hours that an employee worked, or an hourly wage or salary threshold. And we point those out because certainly with limited resources, we'd like to include as many employees as possible, but the reality is we will have to make some tough choices. And these are additional criteria that can be utilized to further define the pool. Those are our recommendations.
Thank you, Commissioner. And I guess given that you're representing the administration, we don't need to call on the other two commissioners unless there's reason to do so on this point. I guess most of my criteria overlap with a lot of what we've heard today. I would add a couple in this related to administration. I think that administrative efficiency measured by both speed and cost are relevant to the kind of decisions that we're going to make. So we should not design a distribution method or a set of criteria that will be very difficult to administer and significantly delay or increase costs for providing the funds. In addition to that, administrative efficiency, I think that there should be some recognition of financial need in the distribution of funds or the allocation of funds based on income in some way, because in part that's in the legislation when it talked about adverse financial impact. I think that's another way of saying that there's a financial need aspect that we should consider. And then I guess the last one that I don't think has been mentioned is that, and this relates to how the program can be administered. I think that we have to have some sort of system where individuals are not dependent on their employers for access to the fund. I think that the individual workers, whether it's through, I'm thinking of the presentation from Commissioner Doty. I think that whether workers are applying themselves or the state is using some criteria and distributing funds directly without application by workers, I think under either scenario or whatever approach we take, workers should not be dependent on their employer's participation voluntary participation in order to be able to access the funds. And the last point, I guess, and I think I phrase it somewhat differently, but when I think of essential workers, I think of the people who had to treat people with COVID or be in COVID environments like hospital and long-term care settings as having increased risk. And I think of the people who were essential to their ability to continue to do that work as also being essential and who had some kind of increased risk of exposure. So I think of the whole healthcare system not being just those individuals who are providing direct care, but all of those whose work is necessary to support the healthcare sector are essential in the sense of the work of nurses or PCAs or long-term care workers could not continue without a whole support system of workers around them. And I think that that work is also essential and needs to be considered. And I don't know that we said that exactly that way, but I think that obviously encompasses more people, but it is still tied to the criteria of having been part of a broader healthcare system that was necessary to respond to the pandemic. So thanks everyone for bringing these. Obviously there are some differences. And I'm happy to have some discussion now, but I think for purposes of keeping the conversation moving today, it would be helpful to not debate necessarily. And I'm not even sure that that's the mind or the kind of spirit of things here, but to report back a distilled list of criteria and see if the committee can at least start to find agreement on principles in our hearings next week and go from there. Senator Kiffmeyer, I see your hands up.
Yeah, thank you, Mr. Chair. I think the one thing I just wanted to clarify, so the name of our work group is Frontline. I get a little mixed up sometimes. Frontline Worker Pay Working Group. I think that's the proper title, but it is about frontline. I don't know if we've just defined yet what frontline is. And I think for the future consideration, I think we could all think about what does frontline mean? Because that's the name of our work group, it's in legislation. And I think we should have a criteria that also says this is frontline. And I totally agree on the broadness in regards to recognizing all of those things, but I think it's particularly important since it's the name of our group to kind of refine that for our next meeting.
Senator Kiffmeyer, I think you're right, and I think that is essentially exactly the work of this working group, to define what that means and then to see how we can allocate resources accordingly.
Thank you.
Okay, so as I said, what I'll propose to do is circulate a summary of these criteria amongst the committee based on notes that we take, and see if we can reach some kind of at least understanding of what the various criteria are and begin to push towards a set that conveys the sense of the whole here and then allows us to begin to move towards identifying who best fits those criteria, and what kind of program best fits those criteria. Next on the agenda, we have Commissioner Robertson with the presentation.
Thank you. I too am having just a few technical difficulties, so I will ask for your grace and consideration in advance. But in the interest of time, I would just like to point out that this presentation is included in your packet, but I've been made aware that out of consideration for the large number of individuals interested in testifying, I'll move through these fairly quickly and give you just a perspective as to the impact of COVID on the Minnesota workers' compensation system. So when COVID hit, the legislature enacted a presumption of work comp coverage for some of the workers. The statutory language gives covered workers who file a workers' compensation claim a rebuttable presumption that their contraction of COVID is presumed to be work-related unless the employer can prove that their infection was a result of non-work exposure. This specifically covered police and firefighters, department workers, healthcare workers, correction workers, and those that were that could be tied directly. So this also means that there was a great significant number of workers that were not covered by presumption. So we have to find that balance in the discussion as well. Now, although more than 2.5 million individuals were not covered by workers' compensation presumption, it did not mean that they were not subject to the workers' compensation law. Those individuals have the right to file a workers' compensation claim if they can demonstrate that their injury or illness did occur in the workplace. Next. Um, 86% of the reported claims from workers were in presumption groups. The fall surge made up a significant amount, nearly 60% of all the claims included. The bump in blue line in July of 2020 represent mostly meat processing claims. Keeping in mind that there are workers that are not covered by Minnesota workers' compensation law, and that includes self-employed people, sole proprietors, federal government employees, certain farm laborers, or family members working on a family farm, and some household workers. So this is not a complete picture. It is really the minimum number of Minnesota work-related COVID cases. Next. The presumption of work-related relatedness was the most important factor affecting whether workers could receive workers' compensation benefits for COVID illness and disabilities. And as this graph shows, again, presumption claims were the highest number of claims that were accepted. Non-presumption claims were fairly minimal. Next. This graph shows that non-presumption claims were 5 times more likely to be denied, whereas the presumption claims put the burden on the employer to demonstrate that the illness was not due to a work-related factor. Next. Um, 74% of the claims were from healthcare establishments. This has been demonstrated and discussed throughout the pandemic. This is definitely demonstrated in the work group, the significant impact that all healthcare institutions were impacted. Corrections made up a significant amount. All other industries combined, there was over 2,300 cases, meatpacking 978, and emergency response 905. Next. Non-presumption claims, as I indicated earlier, had a tremendous impact. This slide shows the rate of denials for presumption industry occupational groups. The denial rate for emergency responders and correction workers are under 10%, and the rate is slightly higher for healthcare workers. This is because we cannot accurately identify which healthcare worker met the presumption requirement. It groups it as an occupation and not the specific job duties of the individual. To date, no meatpacking industry workers have had a claim accepted to receive any workers' compensation benefits. Next. Half of all claims were from hospitals and nursing homes. This graph shows that the top blue line represents healthcare. The green is emergency responders and corrections. And then the magenta are non-presumptions. Hospital and nursing home workers clearly benefited from the availability of the workers' compensation benefits made available to them. We did not see the same rate of acceptance in other occupational areas. Next. And this just starts to break down the specific roles that individual claims came from. So this again speaks to, it took a lot of different workers to ensure that work was performed. So registered nurses certainly had the highest rate, and then it breaks down from there. Nurses' aides, other healthcare support, personal care aides, licensed practical nurses, home health aides, all the way down to social workers. So the impact is definitely significant and touched workers throughout the healthcare system. Next. To date, or at the time of these statistics, only 15.6 million have been paid in indemnity benefits. And as you can see, again, in the presumptive, under the presumption care, that's where the majority of benefits have been paid. To date, no claims have been paid for permanent disability. Only 22 claims have settled, and only 6 claims have resulted in payments of a death benefit to the survivors. These values are based on benefits reported to date, and claims that are still open will have more indemnity to be paid. So this is preliminary work. We are still processing. Some of these claims are still active, so this does not represent full or final payment. This is simply what we know at this time. Also, this does not represent any medical payments. However, the State Workers' Compensation Data Service Bureau report that most claims do not report any medical services. And among those that do, the amount average about $500 per claim, which is, I've been told that's nearly the cost of the testing. So many of the claims that are identified did not have any medical costs, and the indemnities that have been paid out have been relatively limited. Next. That concludes my presentation. If there are any questions, I'd be happy to address them. Hope you find the information helpful. Thank you.
Thank you, Commissioner. Questions from the committee? Commissioner, I have one. Can you explain a little bit more about the 100% denial rate for meatpacking and poultry workers?
I'll do, Representative Winkler, I'll do my best. The department began to notice that in spite of the large number of cases that were reported by the Department of Health, meatpacking employers had not filed any workers' compensation claims. When we saw that trend, we reached out to employers that are associated with the meatpacking industry. We explained to them that the employer have an obligation to file a workers' compensation claim if they have information or should have information that an illness is related to a work activity. We've had numerous conversations with employers. Some employers eventually filed claims, but all the claims were denied. The Department of Labor and Industry have somewhat limited ability in this area, in that if the employees of those organizations have a right to pursue workers' compensation. But if we do not hear directly from an employee or an authorized representative that the claim was in fact based on the work, then we have no ability to force the claim itself. And so it has to be participatory, in that employees say, some employers claim that, some employers have taken the position that at the time that the large number of meatpacking workers were diagnosed and reported to the Department of Health, that was broad community spread of COVID, and therefore they took the position that an individual worker could have come in contact with COVID outside the workplace. Some employers did, in fact, file claims after they were notified by the department, but subsequently those claims were denied by the employer and the insurer on the basis that there was community spread, therefore there was nothing directly tying it to the workplace.
And Commissioner, I think just state, I guess, again, were meatpacking and poultry workers entitled to the workers' comp presumption?
Representative Winkler, no, they were not included in the presumption language.
Thank you. Senator Kiffmeyer, I saw that you had your hand up.
Well, I did, Mr. Chair, but you're really going down the same question, that I had. So those answers take care of my question as well. Thank you.
Okay, thank you, Senator Kiffmeyer. Further questions? I am able to see hands going up if any other committee members have questions. Okay, I am not seeing any. Thank you, Commissioner, for your presentation. As we move to the public testimony portion of the hearing today, because I'm operating from my phone and it's a difficult act to get to that. I'm sorry, there is more from the department, but as we move to public testimony, we will be shifting to Senator Housley chairing that portion of the meeting, as she can work through that list better than I can in my current circumstances. Commissioner, do you have another part of your presentation?
Chair Winkler, this is Deputy Commissioner Nicole Blissenbach. I did have more to present from the department.
Oh, you do? Okay. If you could then please proceed.
Okay, so good afternoon, Chair Winkler and members of the committee. My name is Nicole Blissenbach, and I'm the Deputy Commissioner at the Department of Labor and Industry. At the request of members of this committee, I am here to cover two areas. First, area data tracked by Minnesota OSHA compliance within DLI, and second, worker COVID-19 data that was tracked by the Department of Health. So I'll start out with the data tracked by Minnesota OSHA compliance. And I know these materials have been provided to committee members, so I will try to get through this fairly quickly. Minnesota OSHA compliance enforces the Minnesota Occupational Safety and Health Act. Since March of 2020, we have been tracking all of the items listed in this slide. And that includes separating those items based on COVID-related complaints and inspections and citations versus non-COVID related. So I wanted to start by just stating some of the limitations to this data. So Minnesota OSHA data is collected for our internal tracking process and also for federal reporting purposes. It's really not data that was set up in line that lines up directly with the assigned task of this work group. So I just wanted to state that right away. Also, the data reflects worker complaints and referrals from individuals who have knowledge of a particular workplace. As we know, and is always shown within Minnesota OSHA, some workers are less likely to submit complaints, and some workers are not aware of their rights under OSHA laws. Specifically, as these laws and standards apply to COVID as an infectious disease, it's not the first thing people think of when they think of OSHA. Typically, you think of fall protection, things like that. Also, one limitation is that an OSHA inspection provides a snapshot in time and really is meant to address the hazards that are observed at the time of inspection. OSHA standards also provide minimum requirements. So it is very possible for an employer to comply with OSHA standards and still be in a workplace that is high risk. And finally, limitation is that citation data from Minnesota OSHA is confidential until it is final. So we are unable to provide details on unresolved cases. So this is a snapshot of the data that we have within Minnesota OSHA that includes a total number of inquiries from March of 2020 through June of 2021, right around 24,000. There were approximately 176 COVID-related complaints that were filed as formal complaints. Just quickly, the difference between a non-formal complaint and a formal complaint. Non-formal complaints are dealt with by sending a letter to an employer identifying a hazard that has been brought to the attention of Minnesota OSHA and asking for a response from the employer on how they are going to address that hazard. Formal complaints result in an on-site inspection. There were 217 COVID-related on-site inspections, and from those inspections, 173 COVID-related citations issued. The last two lines on this chart are related to discrimination cases. So discrimination within the OSHA context happens when workers who have raised issues with either Minnesota OSHA or with their employer about safety and health concerns in the workplace, then experience some type of retaliation by their employer, whether that is something as egregious as termination or even a schedule change or pay-related hour cuts, things like that. So we did end up taking 547 intakes. That turned into 125 open cases, 95 of which were COVID related. This chart shows just a breakdown of the OSHA data and the COVID related inspections by industry. So as you can see, the highest number of inspections related to COVID occurred in manufacturing, as well as the bar, restaurant, and accommodation industry. I should note that manufacturing here would include meat and poultry processing, as well as more typical manufacturing settings. In total, these inspections, as I mentioned before, inspections resulted in 173 COVID-related citations. And that is the end of the OSHA data. Do we have any questions? I can pause here if there are questions specifically related to this.
I don't see any hands raised at this point. Why don't you, Senator Murphy, go ahead.
Thank you, Mr. Chair. And thank you, Deputy Commissioner. Can you refresh for me the relationship between the inspections by industry and what triggers them?
Yes, I can. So there are a number of different ways that a Minnesota OSHA investigator would be sent out for an on-site inspection. The most common way is for a worker to file a formal complaint with Minnesota OSHA. Under our OSHA laws, a worker does have the right to request an on-site inspection. And the way they trigger that right is by filing that formal complaint with OSHA. Another way would be a referral. So referrals can happen from individuals or entities that have knowledge of safety and health hazards within a work site, but may not be an employee. So that's another way. And then outside of the COVID context, we do have what we call scheduled inspections, and those are inspections in high hazard industries that happen unannounced each year, just to get people out there in areas where we know workers may not be likely to complain.
Thank you, Mr. Chair.
Senator Murphy, anything further?
Yeah, Mr. Chair, and Deputy Commissioner, thank you for that. And so I'm assuming the slide that we're looking at now reflects all three of those categories in terms of inspection. Is that correct?
Yes, that is correct.
All right, and Mr. Chair, just one more if I could.
Senator Murphy.
Thank you, Mr. Chair. Deputy Commissioner, the slide previous to this one where you were talking about cases and discrimination, the ratio in that last line, 95 of the COVID-related discrimination cases of 125, that ratio is pretty strong. Is that between the intakes and the cases, is that fairly typical, or are we seeing a spike in COVID-related discrimination cases in this data?
Deputy Commissioner.
Chair Winkler, Senator Murphy, I would say just based on my discussions with the Director of Minnesota OSHA Compliance, we have seen more discrimination cases throughout the pandemic than we would typically see. In fact, I think it's increased by quite a bit. I can get a percentage increase on that, but I would say that this is not a normal amount of discrimination cases.
Thank you, Mr.
Senator Murphy.
Chair. Thank you, Mr. Chair, and thank you, Deputy Commissioner.
Okay, Deputy Commissioner Blissenbach, do you want to continue? And I think just run through your whole presentation and then we'll go for questions at the very end.
Okay, great, thank you. So I'll continue on to worker COVID-19 case data that I collected from the Minnesota Department of Health. I will try to answer questions as I go through, but if there are questions I cannot answer, I will make sure to get the answer from Department of Health and bring it back to the committee. So the Department of Health, 4 different work groups at the Department of Health tracked worker COVID-19 case data. They tracked it in these 4 different areas: critical infrastructure workplaces, healthcare settings, education and childcare settings, and congregate living settings. These are congregate living settings outside of healthcare, so non-healthcare congregate living settings. So I should start by saying the information that I will present reflects COVID cases, but it does not in any way reflect quarantines after exposure. So this information will be people who did in fact test positive and identified a workplace, not people who may have had to quarantine after exposures. So I'll start out with the critical infrastructure workplace cluster data, starting with some description. So MDH defined critical infrastructure workplace clusters as of November 12, 2020, as 5 employees from separate households with onset dates within a 14-day period. That did change. Prior to that, it was 3 employees. A theme you will hear throughout this presentation of this data is that accurate case counts were and are dependent on case interviews. So where cases were lost to follow-up, or for some reason certain information was unable to be collected, the case is unable to be included in this data. So the case counts presented are likely underestimates. And specific to critical infrastructure workplaces, cases who reported working from home would not be included. And the total number of cases on the following chart, and this is important, are cases associated with identified clusters within that workplace setting. So it's not every positive test, it's a test that is associated with a cluster. So here is the breakdown of the industries and workplace settings that were included in that critical infrastructure data collection. This chart shows that the information broke out by each year, so 2020, as well as 2021. And then on the far right, you will see the totals. So as I said, these are cases that are associated with an identified cluster. Another thing I wanted to point out is when we're looking at these numbers and looking at the total case count, that the size of the universe of employees in each of these categories is not really represented. So we have a number here, but we don't know out of how many people that is. I think, you know, that's possible to figure that out, but that's not something I have in this information that's presenting. Nor do I have the number of workplaces that were affected by a cluster, only the total number of clusters in that workplace setting. So next, moving on to the healthcare setting case data, this would include all cases of workers who reported their occupation as healthcare staff in an identified healthcare setting. So it would not be, it would cover everybody within that healthcare setting, dietary, nurses, housekeeping, it would include all of those individuals if they work in a healthcare setting. The data does not indicate where the worker was exposed. And then another piece is that in congregate care settings, one active case within the facility constitutes an outbreak. So that is different than what we just saw in the critical infrastructure setting. Here, one case constituted an outbreak. And if a facility went at least 28 days without a case and a new case happened, that's considered a new outbreak. For non-congregate care facilities, so hospitals, outpatient clinics, MDH did not have comprehensive data on outbreaks. So that is not included in this next chart, but the number of cases is. So here, this chart does show the breakdown. Again, this is a little different than the data reported in the last chart showing critical infrastructure cases. To be reported on that chart, it had to be associated with a cluster. Here, it was every case is going to be included. But because, but again, it had to be, the individual had to indicate where they worked in order to be put in one of these facility types and counted on this. But these are the numbers that would have tested positive and indicated where they were working. Next, I'm going to move on to childcare setting because there are just less to report here. I didn't put it in a chart. It's indicated in the top two lines, 480 outbreaks in a childcare setting, and staff cases were at 3,565. Here, the staff cases are staff who tested positive and had a potential exposure in the childcare setting. The way they determine that is by looking at which staff attended a childcare program while they were infectious, or who tested positive and attended the childcare program that reported a confirmed case in the past 28 days. Again, this data is limited by the interviews, and there is a listing of childcare programs that were included. One thing I should note is this did include school age care during the peacetime emergency. So that those positive tests are reported here rather than in the pre-K through 12 school setting. And next, looking at the pre-K through 12 school setting case data, again, listed in the top two lines, 905 outbreaks, and here slightly different definition. Cases of COVID in staff who were present in the school during infectious period is 8,979. The reason why they included the staff who were present during their infectious period is they had to develop a proxy for in-person. And the proxy they developed was that the staff member was present in a school during their infectious period. Of course, no proxy is perfect, and it's possible that a school staff member experienced an exposure, went home to quarantine, and 7 days later tested positive. That individual would not be reflected in these counts because they were not in the school during their infectious period. So just wanted to note that, again, suggesting that this is likely an undercount. Oh, and also these numbers are cumulative since August because they started tracking this when schools were reopening for the 2021 school year. Next is the correctional setting, and this comes out of the non-healthcare congregate living work group at MDH. And this here, you'll see total cases. That includes any case, both staff and other folks in these settings, the number of outbreaks, the total outbreak cases, as well as the staff outbreak cases. The staff outbreak cases, again, similar to critical infrastructure, are only those cases that are associated as part of an outbreak. So one staff positive case, unless it was part of an outbreak, would not be reflected in these numbers. And then the final setting as part of the non-healthcare congregate setting is shelter settings. And similar to the last, total cases is the total population, and then the column furthest to the right, 116 staff outbreak cases in this setting. And again, those have to be associated with an outbreak to be included here. So I believe that brings me to the end. As I said, I am happy to answer any questions. And if there are questions I am unable to answer, I will make sure to get answers and bring it back for the committee.
Thank you, Deputy Commissioner. Questions from committee members. I see Representative Frazier, your hand is up. And I see Senator Kiffmeyer. So we'll go to you first, Representative Frazier.
Thank you, Mr. Chair. Deputy Commissioner Blissenblatt, could you go back to that critical infrastructure slide, please? So I wanted to go back to this slide because I just wanted to kind of just refocus on, and early on we talked about how there were certain group of workers that may have been impacted more or in harm's way more in terms of this virus. And I just want to point out that when you look at this slide, it shows that there were outbreaks outside of or people that were in harm's way, our essential workers, frontline workers outside of the healthcare industry. I just wanted to point that out because I think it's helpful to have this data to kind of refocus us back and center that more folks were actually exposed. When you're thinking about our frontline workers, that is hard. Again, it's hard to draw that line to say that there was one group that was more exposed than others, particularly early on in this in the pandemic when we didn't quite know much about how this virus worked. And so that was my observation. I wanted to point that out, but I do have a question. I noticed that, Deputy Commissioner, that there wasn't a high number of OSHA complaints, and I think Commissioner Robertson touched on this a bit. There wasn't a high number of OSHA complaints from the meatpacking industry, and we know that there were huge breakouts in that area. And I'm wondering if you have any insight in regards to why we may not have seen any. We didn't see a high number of OSHA complaints in that particular industry.
Deputy Commissioner Blissenbach.
Chair Winkler, Representative Frazier. I brought the presentation back to this slide to show the COVID-related inspections by industry. And just to note that meat processing and poultry processing would be included under the manufacturing title, which does show 42 inspections. That I believe does include a number of inspections that happened at meat processing facilities. And I can't really comment too much on any ongoing cases, but that number would reflect anything that happened in that area.
That's a combination. Thank you, Ms. All right, Deputy Blissenbach, thank you. And that is a combination of areas, not just the meat packing processing plants, correct?
Deputy Commissioner.
Chair Winkler, Representative Frazier, that is correct.
All right, thank you.
Senator Kiffmeyer.
Thank you, Mr. Chair. My question for the Deputy Commissioner Blissenbach has to do with.
Oh, Senator Kiffmeyer, you're now muted.
Thank you. I thought I had unmuted myself, but thank you. The question I have is in regards to the pre-K school in the building, if you want to go to that slide. The definition there was, it was an outbreak if it was in a building. Okay, my local school district, the building is a very large space. So did you define this by pre-kindergarten space, or, because it says pre-kindergarten through grade 12. So my school districts, these are very, very large. And the fact that you could be in one part of the building and totally separated from the next part of the building, how did you decide what a portion of the building, or how was that looked at?
Deputy Commissioner Blissenbach.
Chair Winkler, Senator Kiffmeyer, this is one I will have to go back to the Department of Health to get an answer on. I believe that the outbreaks were by building, not portions of building, but I can confirm that with the Department of Health and report back.
Senator Kiffmeyer.
Yeah, thank you, Mr. Chair. I think that's really important when we define here that we have that understanding of what that is. So I appreciate getting additional information. Thank you.
Senator Murphy.
Thank you, Mr. Chair, and for the Deputy Commissioner. I am, of course, struck by these numbers and want to go through them one more time. And I really appreciate your ability to sort of describe how the data is constructed for different industries. A thing that stands out for me is the rate of outbreak in meatpacking. And I am wondering if you know, based on what we're seeing from the Department of Health, if there are sites of meatpacking that didn't have an outbreak. Because it looks in the data, and I know this is generalized data, but it looks in the data like it was pretty, it looked like it was happening all over. Do you know if there were meatpacking plants that didn't have an outbreak?
Deputy Commissioner Blissenbach.
Chair Winkler, Senator Murphy, unfortunately, I don't have an answer to that. The only thing I can share is what is included on this slide, which shows the number of clusters as well as the number of cases associated with those clusters in these different settings. Meat processing would be, the meat packing and poultry processing would be included under that. Food processing would include places like canneries. So beyond this information in this chart, it would only be a guess for me to opine on whether there were meat processing facilities that did not have an outbreak. That is something that I'm guessing MDH in tracking these numbers would be able to determine, and I can ask them about that.
Senator Murphy.
Thank you, Deputy Commissioner, and thank you, Mr. Chair.
Okay, I guess I don't see any further hands up for questions. So thank you, Deputy Commissioner Blissenbach, and to Commissioner Robertson for your presentations. It's very helpful, and we want to preserve as much time as we can now for public testimony. And as I mentioned earlier, I'm going to turn the virtual gavel over to Senator Housley so that she can manage the list better under my constrained circumstances. So Senator Housley, why don't you go ahead?
Thank you so much, Chair Winkler. We do have a long list of testifiers. We've got 18 of them. So I will tell you who's up next and then who's on deck so we can, and I'm pretty sure everybody is here. And so just be ready and get yourself unmuted when the next person or when the next person is finished. Also, if you could limit it to 2 minutes, because I'm afraid we're going to run out of time, and I have a hard stop at 2 o'clock, and I know others have said that they have too. So maybe if you have a written statement, if you can just summarize it in your own words, that'll help a lot of us on the committee. So first up, we're going to have Rena Wong, and after Rena, it'll be Nancy Carabantes. So Rena Wong with the UFCW Local 663 Meatpacking. You're the organizational director. Rena.
Good afternoon, Chair and Commissioners. My name is Rena Wong, and I'm the organizing director at UFCW Local 663, and we represent 13,200, more than actually Frontline, essential meatpacking, grocery, retail, and healthcare workers here in Minnesota. I'm here today on behalf of Local 663 President Matt Utek and Local 9 President Rich Morgan to voice our union support to provide frontline worker pay for all frontline essential workers. Meatpacking, as you know, is one of the most dangerous industries. Health and safety is continuously brought up as one of the most important issues, and that constant risk, coupled with this global pandemic, has led to an extremely dangerous work environment and the subsequent COVID outbreaks at meatpacking plants throughout the country. I'm sure you have heard in Minnesota about COVID at JBS in Worthington, Pilgrim's Pride in Cold Springs, Hormel in Austin, and many others this last year, where thousands of essential workers are employed. The JBS plant in Worthington was closed for 15 days in April and early May of 2020, and then reopened 1 week later after an executive order from the President of the United States mandated that meatpacking plants stayed open. UFCW worked closely with the state of Minnesota to develop guidelines to protect the union and non-union meatpacking and processing workers from the deadly virus, but guidelines were not mandatory. Employers got to choose. And OSHA did their best to respond to workers' concerns, but that agency is set up to be reactive and not proactive. And so workers suffered as a result. Nationally, there have been 22,400 meatpacking workers infected or exposed. And here in Minnesota, there are 133 meat and poultry processing plants, roughly 12,000 workers. If you think back to those coded maps that tracked COVID outbreaks by county last year, you'll remember the overlap between where the counties are, they're reporting the COVID cases, and the counties where those meat and poultry plants were located in greater Minnesota. And you all just saw the presentations here that the commissioners and assistant commissioners provided about the impact on our meatpacking plants and on food workers in Minnesota. So UFCW members were required to show up to work so that the people of Minnesota could have access to food and supplies during the pandemic. Our members could not work from home. They did not have 6 feet of social distance between themselves and customers in stores who leaned over them without their masks on. They did not have 6 feet of distance between themselves while they killed and processed meat. The least Minnesota can do now is to recognize food workers and all frontline essential workers by rewarding them for their hard work and sacrifice throughout this pandemic, and make them eligible for this program that you are creating for frontline worker pay. Thank you for your time.
Thank you, Ms. Wong. Next up are all 3 workers at JBS. First, we'll start with Nancy Carbantes and then Cecilia Ramos. Go ahead, Nancy, announce yourself for the record, and I'm going to set the timer.
Good afternoon, Chair and Commissioners. My name is Nancy Carabantes. I live in Worthington, Minnesota. I am here today to voice my support to the working group in favor of providing frontline workers pay for all essential workers. I am a UFCW Local 663 member at JBS. I have been working at JBS for more than 10 years now. I work at the production floor on the ham line. I have been on the safety team over 7 years and a unit steward for 3 years. So many of my family works at JBS, my mom, my dad, my 2 sisters, and my husband. When COVID hit, so many coworkers got sick. We all worked much more to get our production quotes out. That meant working extra hours on weekends. That meant sacrificing time with our families and spending more hours in the plant working side by side, wondering if we would be the next ones to get COVID. So even when we finally got some time off, we were too mentally and physically exhausted to really be present with our families. Me and my coworkers were the same, along with my union family and healthcare and groceries. So we kept showing up to work. We kept showing up so all of us would have food available to buy for our families throughout America and around the world, where our products are shipped. You and other Minnesotans require us to do this, and we are proud we did our part. We are risking ourselves, our kids, and our community by going to work. We can't do Zoom meetings to cut meat. My husband and I both work in JBS plant. We both tested positive for COVID. We have 7 kids at home with us. They are 15, 14, twins of 13, 11, 9, and a 7-month baby. I was pregnant during the pandemic. My 9-year-old has special needs. He tested positive for COVID. Before COVID, he was making a lot of progress with his therapy, even being able to start walking. Now he has gone backwards and is having to learn all over again. I could not be at home to help my kids with distance learning. They told me, Mama, it's hard to do school by myself. There is no one to ask for help when we don't understand. My husband and I love our kids. They are everything to us. But every day my husband and I go to work and we wonder if we are bringing home this virus to our kids, and are especially scared about the younger ones who are not old enough to be vaccinated. Now we are starting to hear about the Delta and about coworkers who had been vaccinated and they're tested positive for COVID. But I can't stay home. My family can't stay home. My union brothers and sisters can't stay home because we have to make sure there is food for everyone in Minnesota to eat. Providing a frontline worker pay bonus to all of us would show up and continue to show up during this pandemic and would be a sign of respect to me and my few union family and need packaging, grocery, and healthcare. Please provide frontline essential worker pay to all essential workers. Thank you for your time.
Thank you so much, Ms. Carabantes, and for sticking with it through this pandemic. Members, we do have to move this along because at 2 o'clock we are cut off. So we have to keep these to 2 minutes and under. So I'm going to keep that timer and I'm just going to let it go. So these are 2 more workers at JBS. So if you have a written statement, if you could just speed it along. Cecilia Ramos, you're next, and then Yolanda Martinez after that. Go ahead, Cecilia. State your name for the record.
Good afternoon, chairs and commissioner. My name is Cecilia Ramos, and I live in Burlington, and I've been working for JBS for 15 years. I'm here today to voice my support to the working group in favor of providing frontline worker pay for all the frontline institutional worker. I am UFCW Local 663 member at JBS. I become to union steward because I like to help in the people in the community that we're working in JBS. A lot of people last year, they were scared because we were getting the COVID virus in the company, in the town. It haven't been here to be, I'm working here in JBS in the day shift picnic line, and I've been doing a lot of work like cutting meats and making boxes. It was hard for us to work in here, but we have to working for all the people because we needed support like the people so they can have like food to eat. My husband and I, we were sick last year with COVID. I have an 8-year-old little boy who was positive last year. I stayed home for 1 month, but as soon as we were getting better, we come back to work to JBS. We are thankful to safety precaution at work when the plant reopened. We also thankful for the vaccination, and we keep doing a good work every day because we hope that things will want and get better. Thank you very much for your support.
Thank you so much, Ms. Ramos. Next up, we have Yolanda Martinez and then Daniel Haney after that. Go ahead, Ms. Martinez.
Sorry.
Good afternoon, Chair and Commissioners. My name is Yolanda Martinez, and I'm a union member of the United Food and Commercial Workers Local 663. I've worked at JBS in Worthington for 31 years and have been a union member for 31 years. I am here today to voice my support to this working group in favor of providing frontline worker pay for all frontline essential workers. I work in the cryovac department at the plant. Cryovac means that I work with the machines that seal the product in plastic. For example, while the butt cut is coming to me down a chute, I use my hook with my right arm, slide to another conveyor, and then it goes to another machine, then it gets bagged. I also prepare boxes for the product. Yesterday, as soon as I got into work, I made 300 boxes, put liners in them, and labeled them. It may have only taken seconds to describe what I do all day, but it is hard physical work, and I hustle to make it all work. But before COVID and now, I am concerned about the fast production line speeds at the plant. We are expected to do quality work, and we hold ourselves to that high standard. I fortunately have not felt sick, even though I tested positive for the antibodies. My husband did get COVID around the time the plant shut down in April of 2020, when hundreds of my coworkers also got COVID. When I returned to the plant when it reopened in May, we were not at full capacity to keep up with the production quotas. Many times we ended up doing multiple jobs just to keep up. For example, my job is supposed to be a 2-person job. Right now, it is only me. When there is reduced staff, we should have reduced production quotas. When we have to work so fast to keep up with less people, that puts our health at risk. Me and my coworkers' health should be valued more than keeping up with the line speed. We keep showing up to work. We keep killing hogs, cutting, processing, and packaging the meat. We deserve to go home to our families at the end of a shift in the same condition as when we left to start our shifts. All frontline workers deserve this. All frontline workers deserve recognition in the form of a hazard pay bonus from the funds we received in Minnesota from the American Rescue Plan. Please develop a program that honors the work we do to take care of each other. Thank you for your time.
Thank you so much, Ms. Martinez. And now we've got Daniel Haney, followed by Renee Brackey. Go ahead, Mr. Haney.
Good afternoon, Chair and Commissioners. My name is Dan Haney, and I live in Fridley. I am here today to voice my support to this working group in favor of providing frontline worker pay for all frontline essential workers. I'm a food processing worker and UFCW Local 663 member at Swanson Meats. I worked there for 26 years and I'm a supervisor at work and a union steward. Before COVID, a typical day at work consisted of showing up, setting up machinery, and working with staff to process food for delivery to restaurants, nursing homes, golf clubs, hotels, and donation sites. A typical shift lasted about 8.5 hours. Now, during COVID, the best day I can think of was March 17th of 2020. That day, our employer signed a contract to make 40,000 pounds of ground beef a week for Cub food stores. That very same day, the stay-at-home orders began. Everything closed down. Well, we never closed at all. We kept processing meat, and now 40,000 pounds more a week of it. Showing up at work was mandatory to keep the food supply chain going. The 40,000 pounds a week to Cub Foods is proof of that. We were also issued cards that showed we were essential workers to stick on our windshields to be able to go to and from work. I am deeply confused how everyone in our union family has been open and running the whole time, doing our best to help everyone out, as well as all of the other frontline essential workers too. And to think we not all be considered for the hazard pay from the federal funds. I know that my coworkers and I have done our best to show we are essential. And I hope you consider that all essential workers should have a shot at some of the recognition we deserve by these funds. Please provide for frontline essential worker pay to all essential workers. Thank you for your time.
Thank you so much, Mr. Haney, and thank you for what you guys stuck with. Next up, we have Renee Brackey and then Claudia Ambrose after that. Go ahead, Ms. Brackey.
Good afternoon, Chair and Commissioners. My name is Renee Brackey. I live in Albert Lee, Minnesota, and today I'm here to voice my opinion on the support for the working group of favor for providing frontline workers pay for essential workers. I'm a UFCW worker, Local 9 member in Austin, Minnesota. I worked for the Hormel plant for 37 years, and I've been on our safety team for 30 years. I work on the production floor of the marinated meats department. Before COVID, we had schedules that allowed us to have weekends off or not, maybe not Saturdays, but at least a Sunday. Once COVID hit, the majority of our plant had been working short, and we worked every weekend. Some parents have had to quit their jobs because of young children or to work and not have a babysitter. So we ran into that with a lot of our different workers. And I've also watched workers lose their jobs besides for the children because they didn't have daycare or daycares were closed and they weren't able to come to work. The workers, we were scared and we still are scared. We've been going to work and watching our coworkers get sick, and the virus is still on our floors, in our packing houses, and to take it home to our families are even more scarier. We all work side by side. We're short workers because of the pandemic, and we've worked hard in our workforce to try and help with keeping food on the shelves and keeping our grocery stores full. We didn't choose to be essential workers. Due to the pandemic, we were deemed essential workers. Packing house workers across the state have proven to keep food on supplies running, to keep our stores full of food so people could eat. We have taken a toll. We're tired and we're wore out. When offices, restaurants, hair salons, and other businesses were able to close, we were not able to. We face the virus every day. Still to this day, we wear face shields, masks to try and protect ourselves in the PPE to do our jobs. We have no idea what work is going to be like every day. So I ask you with this to please give all essential workers who work in Minnesota and have been working through this pandemic and feeding the United States. Please think of all of your essential workers. Thank you.
Thank you, Ms. Brackey. Next up, we have Claudia Ambrose, followed by Janet Nelson. Go ahead, Claudia. Claudia, there you are. Go ahead. You're on mute still, Claudia. There we go.
There you go. Okay. Good afternoon, Chair and Commissioners. My name is Claudia Ambrose. I live in Austin, Minnesota. I am here today to raise my voice and support for this working group in favor of providing frontline worker pay for all essential workers. I'm a UFC Local 9 member and quality pork processors. I have been working at QBP for a little bit over 16 years. I work on the production floor and I'm the walking steward. When COVID hit, I watched the virus go from department to department and from nights to days. I watched coworkers fall as it went through the plant, through our neighborhood and to the apartment buildings where my coworkers live. I have some close friends who are very sick and who still suffer from the effects of COVID over a year. This stuff is not good.
Hang on one second, Claudia. Victoria, your phone is on.
Yep.
Victoria, can you mute your phone, please? Continue, Claudia. Sorry about that.
That's okay. In the plant, there are two main departments, the kill and the cut side. The kill is hot and damp. Workers work and are again wearing face masks. The masks are soaking wet. In no time, it's hot and only it's making a tough job unbearable and almost impossible. In the cut, it is cold, and with a mask and face shield that steams up, and it's making dangerous jobs twice as dangerous. We had no choice but to go to work each day while others could work from home or were out of work because of shutdowns. We kept the state fed, we kept going to work, we kept getting sick, but we kept running. Some nights we were so short of workers, hardly anyone was on their job, but we did it because we knew it was the right thing to do. And you need to do this because it's the right thing to do. Minnesota quickly compensated the farmers for their livestock that couldn't be delivered to the market. Are we the essential workers a step below livestock? Thank you for your time.
Thank you, Ms. Ambers. Next up, we have Janet Nelson, followed by Tim Maurer. 2 minutes each. Go ahead, Ms. Nelson.
Good afternoon, Chair and Commissioners. My name is Janet Nelson. I am an ECFE educational assistant at Hemrain Elementary School in St. Paul. Before the pandemic, I worked in early childhood family education, helping to create intentional learning environments for our youngest learners and their families. However, when the pandemic hit, my colleagues and myself were reassigned to do essential kid care for frontline workers. I was reassigned to work in essential kid care on Labor Day weekend 2020. All the EAs and TAs in ECFE had no option to work remotely. Either we worked the new assignment or we were out of a job. I was upset and scared, but I asked myself 3 questions. Did the children need me? Did the families need me? Was I healthy enough to do this work? The answer was yes. So I answered to the call of duty. When we reported to work the first day, we had 15 minutes to get our classrooms ready before kids came. There was very little figured out at this point, and we had few resources. When the children arrived, we were all a bunch of strangers. In my classroom, I had 2 TAs from pre-K-12 and 12 students who came from 6 different schools. We had kindergarten to 6th grade students. In ECFE, we work with children from birth to 5 years old. It was a huge shift in the work that we do, but we had the skills. I remember an ECFE bus driver was reassigned to this work as well, and he ended up quitting because the job was too stressful for him. My work consisted of making sure kids were following COVID rules to help us stay safe. We provided social-emotional support, engaging kids in creative and fun activities, providing motor activities, and helping kids do online schoolwork. Aside from myself, many education support professionals showed up in our district and across the state. Some were even delivering technology to students and teaching their caregivers how to set up and use it. My colleagues and I were worried about COVID-19. There were times when we overheard kids talking about loved ones who contracted the virus, and this put us in constant fear. One of my coworkers had multiple close family members contract the virus. She went into quarantine. This was hard and stressful work, to say the least, but the kids needed a friendly face and a safe environment they could rely on during uncertain times. Education support professionals answered the call. They showed up and cared for children so that their families could also show up as essential workers. Please consider educational support professionals as frontline workers. Thank you.
Thank you so much, Ms. Nelson. And I hate to, I don't want to feel like I'm rushing all of you. I really, really do apologize because all of the work that you have done is so important. And all of us on the committee want to thank you for sticking with it and doing your job. So thank you, thank you. I just want to make sure that we can get all the way down to Alicia Hernandez so she can get in before 2 o'clock. So next up is Tim Maurer, followed by Elba Escobar. Go ahead, Mr. Maurer.
Thank you, Senator Housley. Good afternoon, Mr. Chair and working group members. Thank you for the opportunity to testify today, and I will move as quickly as I can. My name is Tim Maurer. I'm the Community Education Director for White Bear Lake Area Schools, and I am here today representing the Minnesota Community Education Association, and we very much appreciate that you are all taking up this very worthy cause. As early as March 16, 2020, individuals employed by Minnesota school districts, including school-age care, child care, and early childhood workers, paraprofessionals, and other available hourly workers were assigned to work directly with children 5 through 12 years old in a state-mandated free emergency child care program. As the Director of Community Education for White Bear Lake Area Public Schools, I have seen firsthand the physical and emotional toll that this call to action brought to our employees. From individuals who are caring directly for people ill with COVID-19 to those protecting the healthy and those deemed high risk in hopes that we would end the spread of this devastating virus, the number of additional labor areas that worked to keep our essential services and resources available to all, many of which you were hearing testimony from today, were all eligible for this free essential child care program. Since March of 2020, our employees have continually adapted to keep the children of frontline essential workers safe and healthy. In addition to successfully navigating changes in protective health requirements and supporting the physical and emotional needs of children during their regular hours of operation, our child care workers also provided academic support for thousands of children across the state of Minnesota when school districts were in a hybrid or distance learning model. Some may speculate that school-age care child care providers receive state and federal funds. While DHS certified school-age care programs were eligible for funding, these funds were only able to be used to cover a portion of employee salaries, as we were mandated to provide these services at no cost to essential workers. I say a portion because funds that some schools did receive did not fully cover their costs, and they experienced significant financial losses. After 1 year of providing essential child care, my program alone in White Bear Lake lost nearly $600,000. So unfortunately, we had no funds available to honor our essential care workers with even the smallest amount of additional compensation. Although childcare became an essential service necessary in our battle against COVID-19, it was almost an entire year before our childcare workers became eligible to receive the vaccine. During that time, these individuals continued to work long hours for months without a break or an option to work remotely. Our employees remained dedicated to serving our families and did this at great risk to their own health and the health of their own families. Today, they still play a critical role in the pandemic recovery in Minnesota and deserve to be included in the distribution of direct financial support. Thank you for your time and consideration.
Thank you, Mr. Maurer. Next up, we have Alba Escobar, followed by Waleed Sanbal. So go ahead, Ms. Escobar.
Hello, my name is Alba Escobar. I work for Minnesota as an organizer. I worked for about 20 years in the restaurant industry. I worked for Chipotle Mexican Grill for 3 years. Normally, we were short of people, but when the pandemic started, it was much more. Most of the workers were minors, so the parents, for safety, did not let them work. This affected much more to those of us that continue to work. We were all afraid, but we needed to work, and we had to work long hours. It was very tiring physically and emotionally because we were exposing our health and our family's health too. Unfortunately, the pandemic has not ended, and still there are many workers under these conditions. In Chipotle, they give us an extra 10% for a few months only, but the pandemic did not last a few months only. The pandemic is still going, and it has been over a year. Chipotle sales grew almost 10% in sales from 2020, and we got an extra bucket or two for a few months of the year. That is not enough. There are many companies that are not done enough for the workers. Restaurant owners use the money for their own benefit and did not give it directly to workers. How are we gonna know if they are gonna give them a right amount of money to the workers? It is fair that workers have a voice and can decide how to receive their benefit and that correspond to them by right. and not the restaurant owners. They already have their earning by having few workers working more hours without paying more salaries. We deserve more money. We want all essential workers to be included in compensation and treated fairly by their employers going forward. And by essential, I mean restaurant workers too. And
thank you, Ms. Escobar. We have to move along.
Thank you.
Thank you very much for your testimony. Again, I apologize. Next up, we have Waleed Sanbal, followed by Sarah Dare. And I'm setting the timer. I don't know if people can hear it, so I'm going to give a 15-second warning because I want to make sure we get you all in. Go ahead, Mr. Sanbal.
Afternoon, Chairwoman Housley and commissioners. I'm gonna try to be brief as possible. I just would like to make sure that the NEMT drivers are considered in this. When the pandemic happened, they were the one transporting people to COVID testing, to isolation centers, to vaccine shots. We were not given any PPE for them. So we had to find our own, we had to build our own shields, making sure that we complied with what was required for proper ventilation during all this. This was all in the beginning. And it took forever for anyone to actually start looking at them and considering them as frontline workers, not even just essential workers. They didn't get any raises in terms of the NEMT fees. They were as a bill to increase fees. Was voted down, so they got no extra money for their hard work. These are people of color who come from multi-generational homes, and they took the risk of wiping down their car every day, of wearing their mask, of changing the gloves, not just every day, but they wiped down the car after every person they transported because they understood they had to protect the person riding and the person after that who was going to be riding. And so I just want to make sure that they're considered, given the fact that they worked very hard in this pandemic to keep people safe and to get people who had COVID and who were tested for COVID into the proper isolation centers. And this was in Hennepin County and Ramsey County on Univem campus. We had dialysis centers calling us because no one else was doing it. And they were being asked to step up, and they did. They stepped up, and we have a very low rate of people getting contracted.
Thank you so much, Mr. Sanbal. I really appreciate your testimony and what you did during the pandemic. Next up, we've got Sarah Dare, and then Victoria Johnson, you follow. Go ahead, Ms. Dare.
Thank you, Senator Housley. I appreciate the work this working group is doing to determine funds and how they should be distributed and the discussion thus far today. My name is Sarah Durr. I am the Executive Director at the Minnesota Pharmacists Association. We serve over 2,000 members ranging from pharmacists to pharmacy technicians to frontline pharmacy workers. Thank you for your time today. Pharmacists are one of the most trusted healthcare workers and the most accessible healthcare workers with most access for patients, as most people live within 5 miles of a pharmacy, and on average, patients visit the pharmacy about 18 times per year. I am here today to ask you to please include pharmacists, pharmacy technicians, and other pharmacy frontline workers such as clerks in your consideration for the frontline worker payment that will be distributed. Since the beginning of the pandemic, pharmacists, pharmacy technicians, and other pharmacy frontline workers have been caring for patients by providing COVID testing and vaccinations on top of their other duties to fill and counsel on medications and provide other services to patients. Pharmacists, pharmacy technicians, and pharmacy staff have truly been at the front lines before we truly understood what the COVID virus is. Additionally, pharmacists and pharmacy technicians in healthcare systems and long-term care facilities have put patients first and served the most severely ill patients, including patients with COVID, side by side with other healthcare providers such as physicians, nurses, and physician's assistants. Many of these workers have put in overtime and weekends and have risked their own health and their families and close circle of people to be there for their communities. Additionally, pharmacy technicians and pharmacy frontline workers are underpaid or paid at a lower rate than the risk they put forth during COVID. We understand that there are limited funds to assist those who have been on the front lines during this pandemic. We encourage this committee to please include pharmacists, pharmacy technicians, and frontline workers as you look towards the frontline worker payment program. Thank you very much.
Thank you so much, Mr. Next up, we have Victoria Johnson, followed by Chris Ellis. Go ahead, Ms. Johnson. You're still, oh, there you go.
Hello?
You're good.
Yeah, yeah, let me know. Sorry. Good afternoon. My name is Victoria Johnson. I work at the Minnesota Veterans Home. I'm a nursing assistant. I've been here for 22 years plus. I am kindly asking you to please include the Veterans Home staff in this project. I've been working here, and through this crisis, we went through all kinds of things, and I think you guys heard about it. We took good care of the veterans. So we are asking you guys to help us to include the Veterans Home in this bill. We lost one of our co-workers when the thing started because he didn't have the advantage to take the vaccine. When all the staff got sick, I think you guys heard about it in Silver Bill, we, the Minnesota Veterans from Minneapolis staff, went over there to help the same veterans. So that's why I'm asking you guys, please, if you look into it, considering it, all the other nursing homes are giving bonus to the nursing assistant and the nurses that work in the nursing home. Only the state of Minnesota Veterans Home are not getting anything. So we are asking you guys, please help us with our family. The same way we raise our life every day to come to work. So this is what I got to say. And thank you all. God bless you and bye.
Oh, thank you so much, Ms. Johnson. A lot to think about, and thank you for continuing to go to work at those veterans' homes. Next up, we've got Chris Ellis, followed by Chris Marty. Go ahead, Chris Ellis.
Hey, can you guys see me?
Yep, go ahead.
Good afternoon. My name is Christopher Ellis. I am a dietary aide at Good Samaritan Society in Robbinsdale, where I've been at for 6 years now. And I just want to, to piggyback off what everybody's been saying about, the pandemic and everything. We just want to be boost up more morale, more positivity in the workplace. We're thankful, we're grateful, and we're appreciative for anything you guys can give us, because we've put ourselves out there for a year and a half now almost. And it's been a long, rough, tough road and everything, but we're getting through it. And like I said before, we're appreciative of everything you guys do for us and we do for our families and all that good stuff. And I won't hold you long at all. But that's it.
Oh, awesome. Thank you. Thank you, Mr. Ellis, and thank you
Absolutely.
too for what you do. Great. Next up, we've got Chris Marty, followed by Jim, Gleb. So go ahead, Chris Marty.
The voice.
Hey there. How's it going? Chair, members, and committee, my name is Chris Marty, and I'm a high-rise window cleaner at SEIU 26. I've done window cleaning for about 12 years, as a high-rise window cleaner for about 6. As we're hanging dozens of stories above Minneapolis and St. Paul, I look into the cubicle. The person looking at me thinks I'm crazy, but I also think that person's crazy for sitting at a desk. I love my job, but I also know that it isn't without risk. Buildings have different standards. We jump off the side of a building to clean windows, being held up by a rope less than an inch. This was all before COVID. We would all ride together in a van each day, which has obviously made it impossible to socially distance. Over half the window cleaners in our union contracted COVID. Some of these window cleaning companies keep people working in the winter by what is called special services. A company that I was working for that I left last year because I felt unsafe was doing cleaning in the airport during COVID, including places where COVID had been. I wasn't willing to risk my health while the bosses would work from home. Unsurprisingly, I still got COVID. Some union members didn't even receive COVID pay. Monday, my union, SEIU 26, announced that our members overwhelmingly voted to authorize a ULP strike. We're tired of the lack of bargaining. We're fighting for safe workplace, both in regards to COVID and our long-term work, keeping our jobs safe. I know many of you probably don't think about the work like mine, but lots of other jobs that didn't get much attention, but I felt like it was important to make sure that you heard about what we've went through, and I appreciate all your time.
Thank you so much, Mr. Marty. I'm sorry you got the COVID, and I'm glad you're still here with us. Next up, we've got Jim Gleb, followed by Ryan Ellison. Go ahead, Mr. Gleb. Oh, I'm sorry, Jim, you're on mute still. Not yet. There we go.
Okay, thank you. Good afternoon, Chairman Winkler, Senator Housley, and members of the Frontline Working Group. On behalf of the United Food and Commercial Workers, Local 1189, which represents 10,000 members across the state of Minnesota, I appear before this Frontline Working Group and respectfully request its members support establishing a premium pay program using the $250 million appropriated to the state by the American Rescue Plan Act. Our membership includes retail grocery workers, meat packing, processing, and healthcare workers who have worked the front lines of this pandemic since the beginning, putting their own well-being aside to assure that our communities are fed and cared for. Under Governor Walz's COVID-19 Executive Order 20, our members were classified as essential workers. However, we have always known that our members are essential in the communities they serve. As others were able to work from home, our members went to work to make sure that families could keep their pantries full and put food on the table. Our members went to work to make sure that the vulnerable and the sick received the care they needed. Grocery store workers showed up every day, often working 10 to 12-hour shifts throughout not only the pandemic, but through the days and the weeks of civil unrest. With restaurants shut down, the people of Minnesota turned to grocery stores not only to buy food, but also as a place to gather and find community. Grocery workers served Minnesota families across the economic spectrum. They served other essential heroes like nurses, childcare workers, police officers, EMTs, teachers, and bus drivers. Without grocery workers, Minnesotans would not have been able to put food on their table. Grocery workers came to work despite facing concerns about COVID-19 and the possibility of spreading it to their loved ones. They also had to deal with the anxiety of customer reactions to the COVID-19 masking protocols.
15.
So what we're asking is that a premium pay program for essential workers for both full-time and part-time grocery, meatpacking, healthcare, and other industries making less than $75,000 a year, premium pay can be provided through fixed hourly pay or a one-time lump sum payment given directly to employees.
Thank you, Mr. Gleb.
Thank you.
Thank you very much. Next up, we have two left, Ryan Ellison and then Alicia Hernandez. Go ahead, Mr. Ellison.
Can you hear me?
Yes.
Hi. Chairman Winkler, members and commissioners, thank you for the opportunity to speak with you today about the need to provide premium pay for essential workers. My name is Ryan Ellison. I'm a proud UFCW Local 1189 steward, and I've worked at the Oak Park Heights Kowalski's as a deli clerk for the last 4 years. I'd like to offer a different spin than has been previously said. I'm scared every day about the mental health of my fellow workers. They're some of my best friends to whom I listen and whose needs I try to meet. Our job description notes that it is our responsibility to help customers with their needs to the best of our ability. Nowhere does it say in that job description that we are to function with normality during a global crisis. None of us signed up for this, and being asked to continue working during a pandemic has taken a fierce emotional toll. The number of workers in the store that I know of who see a therapist has doubled over the past 2 years. One of my coworkers, one of my best friends, has had 2 suicide attempts due to the stress of the pandemic. 2 others I know tried at least once, and the idea of a permanent solution has appeared in others sporadically. I myself take psychiatric medication to get through the day. It's my job to make sure that all of the work gets done and people are comfortable, but it has also become my responsibility to make sure my coworkers survive. We didn't sign up for this. Out of our senses of personal ethic and community responsibility, we've remained behind the counter rather than accept the benefits of being at home. Every day is a new and difficult storm, and all we can do is knuckle down and bear with it, hoping that at the end of the day, we are physically healthy and mentally intact. Grocery stores are part of the day-to-day life for Minnesotans, and we have been proud to make sure that such foundational services are provided. The pandemic has placed an undue burden on our mental health and has created workplace challenges that we've never seen before, nor could we have possibly been ready to take on. We've suffered through constant exposure, not knowing if someone has COVID-19 or is even vaccinated. Workers who contracted the illness still suffer from lasting effects months or even a year later. I am asking you to please acknowledge these risks, acknowledge the sacrifices we made and will continue to make, and continue to make and provide premium pay for grocery store and any and all other essential workers in the state of Minnesota. I appreciate your attention. Thank you for your time.
Thank you, Mr. Allison, and I'm sorry about your friends. Next up, we have Alicia Hernandez. Go ahead, Ms. Hernandez. I don't know if Alicia could hang with us. Ms. Hernandez, I don't see you, and I don't see anybody unmuting. I don't know, Representative Winkler, if you wanted to wrap this up or if you just want me to wrap it up. Oh, wait, there's Allie, Forever Allie. That must be Alicia Hernandez. Welcome to the committee. Welcome to the committee, Ms. Hernandez, and go ahead and give your testimony, and then I'll toss it to you, Representative Winkler.
Ay, buenos días a todos los presentes. Mi nombre es Alicia Hernández. Soy miembro de Fe y Justicia y vivo en San Clau. Yo soy una trabajadora esencial porque trabajo en la procesadora de pollos en Pilgrims de Cosprin. Soy madre de 2 hijos y debo trabajar para darles lo que necesitan. Yo quiero contarles que siento miedo de que otra vez se ponga feo con la pandemia porque nos fue muy mal. En mi trabajo trabajamos muy juntos y somos muchos en el trabajo. No hay tiempo para seguir las reglas y cuidarnos del distanciamiento, entre muchas otras cosas que pasan en la planta. En mi casa todos nos enfermamos y uno de mis primos se puso grave. Todos en esta casa trabajamos en la misma compañía y llegó el tiempo en que no había quien trabajara y en mi casa ni en el trabajo mientras otros estaban enfermos y todavía no nos daba el coronavirus, teníamos que trabajar doble y eso nos afectó emocionalmente, físicamente y económicamente a todos. Yo no me podía recuperar y volvimos a recaer en enfermedad. Me enfermé 3 veces y mis hijos también se enfermaron del COVID. Por una parte siento que sobrevivimos, pero a la vez siento miedo que volvamos a regresar a lo mismo. Quiero recordarles que somos muchos los que trabajamos en la agricultura y procesadora de carnes y es importante que nos incluyan a todos en la repartición de fondos y pues yo creo que todos merecemos también que nos tomen en cuenta todos y espero no se tarden mucho pues en esa ayuda porque la mera verdad sí nos ayuda mucho. Gracias.
Thank you so much, Ms. Hernandez. And now I will pass the gavel back to the chair, Representative Winkler.
Thank you, Senator Housley, for pinch hitting here. And thanks to all the testifiers for participating and moving along so quickly. We will continue to take public testimony as we continue our hearings. And I know that members have to wrap up. So with that, we will adjourn until Tuesday.
Recording stopped.